I felt prioritized, and that it was important that the birth experience was healthy and safe, but also that it was going to be as good of an experience as childbirth can possibly be.
Welcome to Birth Without Borders, the podcast that takes you around the world to explore how babies are born. Today we're traveling north to the beautiful Scandinavian country of Sweden. With just 4.5 deaths per 100,000 live births, Sweden stands out as one of the safest places in the world to give birth. Mothers here regularly report positive experiences. But what does the perinatal process actually look like in this seemingly perfect place? Today, we'll meet with a midwife named Mi Wilkström, who works at a healthcare center in Falun, Sweden. She's been a midwife for 15 years and has experience working in the delivery ward, in pre- and postnatal care, and in gynecological care as well. She'll walk us through what to expect from the very first moments after finding out you're pregnant. We'll also hear from Danielle, an American who moved to Sweden a little over a year ago and gave birth just a few months ago. So whether you're considering moving to Sweden, just curious about birth in other cultures, or you're simply fascinated by birth in general, this episode's for you. First, what happens when you find out you're pregnant in Sweden? The midwife, Mi, says the first thing you do is decide if you want to keep the pregnancy.
When a woman calls me and says, "Hi, I've just found out that I'm pregnant," my first question is always, "How do you feel about that?" Very neutral, because some women call us and they want to get an abortion and they're very adamant about that, or they're very secure or sure about their choice, and then we refer them to the gynecological unit in the hospital, because in Sweden all women have the right to abortion, and all women have the right to get help with that. But if you are pregnant and you want to continue to be pregnant, often you come to a healthcare center like us and meet with one of the midwives here, and usually you come within the first week. When you've called us, we try to make an appointment for you within the first week so that we can see you and make an assessment. Is this a normal pregnancy, or are there any complications that we need to be aware of early on in pregnancy? And of course, the most common is that they call like between week 4, 5 to maybe 7 to 9. That's like the most common. When they've been pregnant before, in some cases they call us a bit later, like in the later stages, maybe week 7 to 9, because they might feel that, well, I've done this once before, I know that there weren't any big complications, I feel secure about what to eat and not to drink alcohol and things like that, because that is a lot of what we do for a first visit. We talk about the woman's health status and also about the health guidelines that are current when you are pregnant. So what to eat, what to not eat, how to manage if you are drinking alcohol, using nicotine, all of those things, and help them with whatever they might need help with in those regards.
While people who grew up in Sweden might know that they should call the midwife as soon as they find out they're pregnant, people who have immigrated to the country might not know where to go. Here's what Danielle said.
The way the healthcare system works is different. And I was unfamiliar with it. So what I think we actually did was we got in touch with my son's pediatrician and asked, like, "Oh, where do you go if you think you're pregnant?" And they were able to set us up with an appointment right off the bat. And here in Sweden, you go and see midwives instead of an OBGYN at first. And I don't think I saw an OBGYN the entire time I was pregnant. It was just my midwife, and then I saw the ultrasound technicians occasionally, right, during an ultrasound. And otherwise, it was just my midwife doing all of the things you would do in a care appointment.
So once you find a midwife, what do those appointments look like?
In the early stages of pregnancy, usually we see a woman for 1 hour about in the first week. And we talk about all of those things. We also check her blood levels and also her thyroid levels and see how those are. And then we meet her again, depending on which kind of ultrasound she would like. We do something called combined ultrasound and biochemical testing that has the ability of checking if there is a higher likelihood of the child having 1 out of 3 different genetic abnormalities. So if they want to have that testing, then we meet them after week 9+3. If they want to have like an early ultrasound instead of that, then we can meet them whenever. And then we have a bit of a longer talk and they get to answer a lot of questions about their own health and things like that. We also have an internet program called the Pregnancy Support System that they can read a lot of things about pregnancy, and they can also fill in a lot of different forms that makes it easier for us to start their chart and to make an assessment if there are things that we need to be in contact with the specialist mother care or such. But usually they meet us midwives and if everything is normal, they don't meet a doctor. They only meet midwives. So those are the first couple of visits. Then depending on if there are like special needs of the family or with the woman or with the pregnancy, of course, there's going to be like an individual planning for her. But if everything is perfectly normal, we meet them week 24, 28. I have like a chart here that I can look at. Week 31, 33, 35, 37, 39. And then we induce labor around week 41, a bit after that, depending on if there are risk factors and things like that. Yeah. So we meet them quite often, and in our establishment here, in our unit, we have the possibility of booking them when they need to be booked. So I make the choice when I want to see her again. And of course, I can assess if there are if there are problems that I want to follow up on. And that can be physical or it can be mental. It can be that I screen her for depression, which is something that we do on everyone. And I can see that there are signs here that she might not be doing so well. We also ask everyone about domestic abuse, if there is violence in any kind of area in her life, and that can be from a partner or it can be from anywhere else, and that might be something that we need to follow up on, or she might have fears about giving birth or time after, or there might be relationship issues, or there might be a lot of things going on. But then here we have the possibility of making extra appointments, and we also have here the possibility of connecting a psychologist to the family or parental guidance advisors that they can also meet and have support if it's questions about how do I become a good parent, or we have one child, how is it going to work when we have another child, and things like that.
I saw my midwife once a month until the 3rd trimester, and then it was every 2 weeks after that. We would walk in to the building, and here in Sweden, I think it's really cool. You remove your shoes immediately, or put the little cute baggies over them to keep the floors clean. And your midwife would call you, and you'd take some weight, write down how much weight you've gained. We'd go into the appointment room, and the midwife would ask me how I was feeling, if I had any concerns that had cropped up this past however long it was, right? Couple weeks to a month with sitting around with my pregnancy, and I could take out my list of concerns. And she would also prick my finger and take some blood. And I believe that was testing a couple things, and one of them was blood sugar, I believe. So they checked me every time with that, which I probably needed because because it's hard to to keep your sugar at an appropriate level when all you want to do is just eat candy your whole pregnancy.
When you're pregnant.
All I want.
Makes
yeah.
sense.
It's all I crave is just like, can I just have pie my entire 9 months? That'd be great. Yeah. And let's see, what else did we do? And that was pretty much it until, get further along and they start measuring the baby. She'd feel around to see like where the baby was positioned, and things like that. But it wouldn't take very long, right? Like 15 minutes, maybe 20.
Mm-hmm.
Not too long. They were really thorough, actually, in telling me about pregnancy, even though they knew that, you already have a child, right? We know you have a pediatrician with this other child. They treated me like I had never given birth before in a way where they just said, hey, like these are the risks for your pregnancy this time, or this is how we do things in Sweden. They would actually send me home with pamphlets, right, in Swedish and English about what our appointment was about, so that I didn't
That's
forget.
amazing.
Oh, and it had phone numbers in it. I always lose phone numbers, so that was helpful to know how to contact the doctor. Yeah, they were really helpful in telling me how to get a hold of them, especially because personally I feel like Elva Hutihu, right, the 1177 site. It's a website where you go and get your appointments set up here in Sweden, and it's all in Swedish. I find that really, really hard to navigate. So just getting some direct phone numbers was a lifeline. Like, thank you. I don't have to navigate the website. Thank goodness.
Sweden consistently ranks within the top 5 to 7 countries globally for English proficiency, and approximately 86% of students who graduate from school can speak it at a conversational level. So it's easy to find care if you're new to the country and speak English, but there can still be some language barriers when accessing care.
At times, not my midwife. My midwife spoke really great English, but sometimes the ultrasound technician might have less English. But for me, that was never a huge problem. I felt like, I could simple Swedish and they could simple English, and we'd meet in the middle and everything's fine. And they have a pamphlet in English, right? Just in case, anything falls through the cracks, so to speak. No, and sometimes I would have friends come with me to my appointments, also because we're car free here in Sweden, and sometimes I would not be super up to walking a couple kilometers while being pregnant to the to the appointment, so I would call upon a friend with a car, and they would come with me and offer to translate into Swedish, but it was never really necessary. We were able to work around if even that was necessary.
I can feel that in some cases, of course, we always make sure that if a patient is in need of an interpreter, we always have like a telephone interpreter. But in some cases, that can act like a filter between us and the patient. And of course, it is always easiest to talk straight to the patient. So in our unit, I often take care of English-speaking patients because I'm quite comfortable speaking English, and it's better for the patient not to have an interpreter like in between us. But in a lot of cases when we have women who are from different backgrounds and might not be comfortable speaking Swedish or English, we might need to have an interpreter. And that can sometimes make it harder for the patient to maybe talk about everything. So that is, of course, a risk that she might not open up about everything. And that is hard to know if it is a cultural thing or if it is an interpreter thing, or is it just that maybe it's not a big thing in her life. But if this would have been a Swedish woman before me, she might have thought differently. And of course, everything that goes on in life is something that one patient can feel is a really big and heavy thing, and the same thing for another patient can be like, that's the way it is, and I'm fine with that. So of course, everything is very based on what that patient is in need of and what her issues are, what she thinks about it. It should never be about what I think about it. But having an interpreter can sometimes be an hindrance, sort of. Yeah.
Overcoming language barriers is just the first step. Once communication is established, Swedish midwives focus on empowering parents to make informed choices about their birth. Let's hear how this approach shaped Danielle's experience as a newcomer.
Oh, so something they did that I really liked and thought was really interesting is they asked me, what do you want for this birth? Which was, I'm like, wow, what a question. For it to not hurt. Can you do that? That would be awesome. And we just talked about expectations and what could be accomplished, what was important for the pregnancy. I could even bring up concerns that I had, like tell them, like, I don't have a car here in Sweden. If I go into labor spontaneously and no one is around to help me, how do I get to you guys? And they were able to help me understand how things worked in Sweden, right? Like for that instance, they were like, oh, like, don't worry. If that happens and you're alone, call an ambulance and it will bring you immediately there. And because it's Sweden, it's free. Or they were like, or you can just call a cab, right? If you're not feeling like an ambulance is necessary, call a taxi. You do have to pay for the taxi though, but the taxi will be reimbursed if you give the hospital the taxi bill.
Wow.
Yeah, so
Amazing.
they were really able to calm my fears about what was going to happen with my body later on. And yeah, and they were able to let me know what pain relief options there would be on that day. And I remember they even wrote it like in my chart about what I wanted. And I remember that being a priority of, the day of the birth, what would you like it to look like? Which is so cool.
That is cool. So did you have like a birth plan that you came up with, or was it kind of just talking with the midwives, figuring things out together?
Right. So I totally expected that, I'll sit down and do a birth plan. But this time it was my midwife and me talking, and she asked me things like, do you want to, like obviously like pain medication, like how much do you want? What do you want? Here are your options. And beyond that, it was like, how much like of the vaccinations would you like? Or, would you like us to clamp, the cord immediately? Or do you want to, delay clamping? And they even would tell me when they were sitting there with me, they're like, you don't have to make a decision right now. You can take this home and think about it, or, involve family if that's what you need to do, or that's what it's important. But because it's me, I'm always like, oh, it's okay. Like, I can just tell you right here what I want. It's fine. Yeah, but it was very, I felt prioritized, and that it was important that the birth experience was healthy and safe, but also that it was going to be as good of an experience as childbirth can possibly be.
We recommend that the patient has a contact with the delivery unit when she feels that she needs to. The midwives in the delivery unit are there 24/7. We always have one coordinator that is a midwife who answers the telephone and can also like answer questions during if it's like late at night, if I'm not here at the office, or if it's on the weekends, they can always call that unit and ask questions if they have them. But if they feel like they are about to give birth, if it's like a normal time to give birth, we recommend them to have a contact with the unit if they have regular contractions that they feel are painful and unmanageable at home, or if they have like 3 contractions in 10 minutes that are quite effective and they've had it for a while and they feel like, maybe I should go into the hospital. Or if the water is broken, we always want them to go in for a checkup. Or if they have a vaginal bleeding, we always want them to be in contact with the unit as well. And of course, there are other guidelines. If they are premature, we want them to have a contact, before the water's broken, if they have contractions. But those are the guidelines when they think that might be a baby on the way.
Sweden is actually where I got my master's degree in global sexual reproductive health. And while I was there, I had the opportunity to tour the labor and delivery ward in the hospital. I'm from the United States, where you have 3 options for giving birth: in a hospital, in a birth center, or at home. Many people choose birthing centers or home births because they don't like the stiff medicalized environment of hospitals with all their rules and policies. In Sweden, there are no birthing centers and very few people give birth at home, but their hospitals, at least to me, felt like a birthing center. They have pools if you want a water birth, you can bring things from home, and the overall atmosphere is welcoming and bright. Let's hear what Danielle had to say about the hospital.
Okay, yeah. That's a good point. So I don't remember a whole lot about the hospital itself because we were there kind of a super short time, and I went into spontaneous labor this time and didn't need to be induced, which was my whole goal for this pregnancy, was to never ever be induced ever again. So went into spontaneous labor, and I labored at home as long as I could, just also because I was anxious about leaving my son because we don't have any family here who would take care of him. So he was going to stay with good friends who did a great job with him, of course, and he loves them. But I was also, had that little fear of like, oh, don't leave my child with friends for too long or they'll never want to be our friends again. But there was no real worry there, of course. But so I was only laboring at the hospital for about an hour and a half before the baby was out. But in the actual room where you're laboring, they had some posters that had women laboring in different positions. So it was like, if you're in a lot of pain, maybe try this. And it had different pictures as well of different pain relief options that you had. It's like, oh, like if this isn't working, maybe try this, some options. And my favorite thing that they had is they had a bullet list for the partner of the person giving birth. And it was like, here are some options for you if you don't know what to do and don't know how to help, which is super cool. And it was like, ask your, significant other if they need a drink, try counter pressure if they want that, that was awesome.
That's amazing.
It was super awesome because I waited so long. We were in a little bit of a hairy situation. And it's so crazy because I was induced last time, I didn't remember exactly how the contractions felt, which that's a crazy thing to say, but I really just forgot what they felt like until it was happening. And I'm like, oh, okay, I remember this pain. But as it was ramping up, I kind of was still unsure. I'm like, okay, like, is this more serious now? It was to the point where it was getting unbearable for me. So I knew we needed to go to the hospital. And when we got there, I was well ready to be admitted. I was about 6 centimeters dilated and 90% effaced. So we were ready to go almost.
And did they tell you when to go to the hospital?
They did. And this time around, well, I guess I did this a little last time, but this time around, I was really trying to see how long I could go without pain medication. Not because I'm like, oh, we shouldn't have pain medication. I just wanted to see how how extreme I could get, like how
Personal
long I
goal.
could. Yeah, yeah, for science, just to see, to experience it, I suppose. And as I'm at home and it's, very painful, and the friends who were going to watch my son come up in their car. They were able to take me as well, but they see how much pain I'm in, and they were like, "Are you sure that you want to take, my son right to the house first? Are you sure you don't just want to go to the hospital?" And I remember being like, "Oh, I'm fine, right? This is a summer picnic. We're fine." And it was the first day that it snowed in Sweden, that day that I went
Oh,
into labor. So there was slow traffic, and there were snow plows out. And after we had dropped off my son at the house with the friends, right, the other friend was driving us, and we totally got stuck between a couple of snow movers, and that's when you could feel the tension in the car, where my friend was like, "Okay, well, we might have to deliver this baby right here in the car." Great.
oh
We're so
no.
glad. But luckily we were able to get around them and went to the hospital.
Here in Sweden, we often offer the parents or the expectant parents like courses in like having a baby, and then one of the meetings can be about pain relief and things like that. And if they don't attend one of those courses, we always give them written information. There's information on the internet that are like written from this region that we tell them
Mm.
about. This is what is offered in this hospital, and we also talk about it on the visits here. So they often are very like well aware of what options they have. And of course, when they're at home, we recommend them to maybe have like a hot shower or a bath if the water hasn't broken, paracetamol. They can have a 10th, what do you call it, like an electrostimulation device
Yeah.
um, that they can rent from us, that they can have from home and bring it to the hospital and use it when they have contractions. They can have acupuncture, they can have sterile injections, they can have gas and air, they can have like an epidural, and they can have a bath in the hospital as well. So there's a lot of different things that we can offer them. Also just hot packs and things like that that are available to them. And it's often like depending on what the patient wants. Some women are very like sure about what they want. I need to have the epidural, and of course then we try to make that happen for them. And if they want to see what it's like, then it's completely up to them. We inform them about the pattern of contractions, what it's like, and that this kind of pain is not like any kind of pain that they've felt before if they haven't given birth. It's usually like you hit your toe and it's like pain, and then it like slowly subsides. But this is a different kind of pain, and we try to encourage them that they can endure the pain for that short period of time that it's the most intensive, and try to see it as like a positive kind of pain, that it's leading somewhere. It's supposed to happen. It's supposed to be there, and we try to help them to manage that. And to breathe through the pain, and for the partner to also be very active during the birth and have like an active role. So we try to give the partner tools as well to be a supportive partner, because that is trickier than you might expect. It's an easy thing to say, be a supportive partner in the birthing suite, but how do you do that? So we try to be very hands-on and tell them exactly what to do and what can be helpful. So yeah, it's all
I
about
love that.
what they want to have.
That's amazing. I love
Yeah,
that not only are you helping the woman, you're helping her partner help
yeah, yeah,
person giving birth.
yeah. We're very much into that. for the body to be able to give birth, we need to have oxytocin. And oxytocin is released when we feel peace and quiet and comfort and safety. And that is something that their body is usually already connecting to the partner. But we who are midwives and come in and out of the room, and we might be there for a certain amount of hours, but then my shift ends and a different person comes in. And of course, that can be something that is a worry for the body and might start to trigger adrenaline, and might be something that the body feels equals fear, and that is not something that we want. So we want the body to be safe and secure, and we know that the partner is the person to be involved in that. So that is something that we focus on, to try to help the body who is giving birth to feel as secure and as safe as it's possible. Usually when you're in active labor, not a lot of women in active labor wants to have like a full meal, but I know that it's some women who have given birth in other countries before and then they come to us, they can feel that it's like weird because here you get to eat stuff. And we say that it's fine to have like an ice cream smoothie, or you can have different soups, or you can have a sandwich, or you can have candy. We tell them to bring your favorite candy, because you need like fast carbs and sugar. You need to keep your energy levels up. So we want them to like eat small things. And of course, if we see that this is going like not the way that we want, we might end up in a C-section. Then of course we might tell them, okay, now we need you to be fasting, and we're going to connect an IV and make sure that you're not going to be in discomfort because of that. But that is because this is what we're seeing. But in the normal case, usually you have things to get into your system sort of all the time. So that is not very restricted. But of course, when you deliver in the hospital, often what we would like to do is to get like a CTG registration of the baby's heartbeat when you come into the unit. If we see that it's good for us to know, we might want to do a vaginal exam and see how open you are. If it's okay with you, we would like to have a central line or a line inserted in your hand. And of course, if the patient says no, that's completely up to her. But we would like to explain why we would like to have that availability. But there are no things that are like very strict that we need to do or have to do. There are some things that we encourage the patient to do. Go to the bathroom and try to pee every other hour, so that the bladder doesn't fill up with urine and cause the baby to have a hard time coming down into the birthing canal, for example. But there aren't things that you need to do.
Once we got into the hospital, I was in a lot of pain. And at first I had wanted to start with, the lowest pain relief options and work my way up. And the lowest option was the tensing unit that they'd hook you up to provide some of that counter pressure. And I was like, I think we're beyond that. So I'm like, let's just go straight to the laughing gas and see how that goes. And for me, that was it probably would have worked better had it not been like a clamp over the mouth, because for me, it made me feel claustrophobic. I'm like, oh, like now I can't breathe air. And it kind of kicked like a panic response in me. And I started to panic because I'm like, oh no, like there is so much, pressure in my body, and it's out of control. And, we all hate feeling out of control. So, so I just ask, I'm like, oh, let's do the epidural now. And of course, in Sweden, they don't have the same thing, like an epidural. What they have as an epidural, they explained to me, is kind of like a spinal tap, where they put the medication straight into the spine. Something like that. and it only works for 2 hours, and it's not as intense. So you don't need a catheter or anything with this type of epidural. And it's just enough to numb you, so it's not horribly painful, but you can still feel when the contractions are happening. It's just like slight cramping instead of overwhelming, horrible pain. So I'm like, okay, let's get that going. The gas is not working. I did my best. And that's when my midwife asked me, like, hey, like, where is the pain coming? Because they had me lying down on my back on the table. And I was like, it was making the pain so much worse. And I do remember they tried to provide counter pressure on my back, and I'm like, that is not doing anything. And I was like, all of my pain is just right there in the front, right, of the pelvis. And my midwife was like, oh, like baby's head is a little stuck right here is probably what's going on. And so they just had me switch birth positions, because they're like, the baby's head just needs to come down around that bone, I suppose, that she's ramming her head up against it. So yeah, we'll change position and let gravity guide her head down further. And they brought me on my hands and knees on the table, and all of a sudden there was much less pressure. It was still really painful, but that panic-inducing pressure was gone, and that was almost like magic. Like, wow, that's what it took. I still got the epidural though. All that to say. And it was lovely. And I was able to get up and walk around after I had the epidural. And at one point they said, hey, we're just waiting for your water to break and then you're good. And I was walking around trying, to get my water to break. And they had the night switch, right? So the day nurses went home, the day midwives went home, the night midwives came in, and I let them know. I'm like, hey, like, I don't know if it's anything, but I just, might have felt some activity downstairs, but who knows what it is at this point. And so my midwife checked, and she was like, oh, well, it's a whole baby head sticking out of you. Oh, yeah, we are crowning a lot. So let's go and have this baby. And she said, how would you like to have this baby? And I'm like, well, I'm really comfortable as I am right now, standing. And I'm like, can we just make that happen? And she said, well, yes, was the answer. Yes, we can. And they brought a bean bag out for me, and they put like a little towel on it. And they brought me a stool so I could put one leg up, and my husband secured me from behind, and they reached out to catch the baby, and I had the baby right on the bean bag.
Wow, so she fell right under the bean bag?
Uh-huh.
Amazing.
And yeah, and it was great. It was like a controlled fall, but it was
Right.
It was lovely. It was great because then they checked me, and I only tore a little, and I didn't even need like a perinatal, bottle for afterwards for cleaning and the cleaning stitches or anything. It was like a simple stitch or two, and when the baby came out, they just gave the baby to me. They didn't take the baby at all, actually. And I was like, oh, when are we going to do those tests? And I had said, oh, let's delay clamping, because why not? And so I thought we're waiting for clamping, we're waiting for, after we cut the umbilical cord. But after we cut it, they still hadn't taken the baby. They had, made sure that the baby was breathing and everything, and nothing was in dire situation, but they just allowed us to bond. And they actually, what they did next is they brought me a sandwich. Oh, and while I was laboring, I forgot this, they brought me a chocolate milkshake that my husband had let them know that I am partial to the milkshake. So, and that was awesome. And let's see, the sandwiches were amazing too. They were open face Swedish sandwiches, artisan even, with like gratis written on them as well, like congratulations. And they had like little flute glasses full of like some sparkling juice for us to drink too. It was so cute.
I love it.
Awesome little celebration. And they also never cleaned the baby off either. I guess here in Sweden, it's very normal just to let the baby be in the, I don't know what we'd call it, like the after, but like the birth fluid. And yeah, that was a little shocking, but it also wasn't a problem either, especially if, I was like, well, if it helps, all of my family get horrendous eczema. So, if that's going to be a delay factor or anything, like, so be it.
Birth is only the beginning. The care and support that follows in the postpartum period can shape a family's experience just as much as being pregnant or the labor itself. Let's hear how Danielle found comfort and guidance in those first few hours and days after giving birth in Sweden.
I think so. We were in that bed that I had given birth. Well, I guess I didn't give birth in the bed. It was the bed in the room where I gave birth. And they let us hang out there for a while, like an hour to like an hour and a half. They let us eat our sandwiches there. They brought some for my husband too. And I don't think it was, they let us stay there for a while before they moved us to the hotel. So after you give birth, you don't stay in the hospital per se. They have an adjoining hospital where you stay in an adjoining hotel where you stay in a hotel room. And everything works basically the same though. Instead of having nurses come into your room to give tests to the baby, they do a little bit of that, but mostly you just take the baby and you wheel them to the hospital from your hospital room. They have like a sky bridge too, so you don't even have to get dressed and go outside. It's super cash. Don't even have to put shoes on.
Wow. So how long did you stay in that little hotel room, and then how often did you go for little checks while you were there?
So we were in that little hotel room for just one day. It was unusual that we left that early. And it was really just because I was like, oh, feeling anxious for my other kid. But we would go and get breakfast and lunch. Actually, to be honest, I wouldn't. I would stay in bed and I would send my husband to go grab us breakfast and lunch and dinner. They also give you fika if you want as well. It's like the tea time meal if you want as well. And all of that is free. Not for the husband or the partner of whoever you have in your room with you, but still awesome. And they're all like fresh made that day. I'm pretty sure they have a chef that is there making fresh food, which is awesome. I mean, I love cafeteria food too. Little Jell-O cups are awesome, especially after birth. Oh yeah, Jell-O cups. But yeah, this is really cool to have some fresh food made every day. The one day that we were there. But you can stay longer. And the checks are, I think we took the baby once for like the screening panel, right, to check hearing and things like that. And then we took them one more time for another check. I can't really remember. So it wasn't that often. They try to group as many of those, the little checks that nurses would do throughout the day. They try to just fit that into just one check or a couple times that day and then let you sleep or, deal with, your newborn.
Usually you're in the delivery unit for a couple of hours straight after giving birth. And we do some checkups on the mother and on the baby. And we encourage the mother and baby to have skin-to-skin contact uninterruptedly for at least the first hour so that the baby can on its own come to the breast and breastfeed if that is something that the family or the mother wants. And And then we do checkups on the baby, weigh and check the length and all those things. And if there is a medical need, they're in a unit that is like maternity care unit. If everything is fine, mother and baby are fine, then they go to like a patient hotel in the hospital complex, and they have checkups in the aftercare unit. And so they do that often for a couple of days. So when the baby is 48 hours, we have a checkup on the baby with the baby doctor, and they check like heartbeat and pulsations, and we check eyes, and we check the hearing and a lot of things. And after that, they go home if everything is fine. In some cases, of course, the baby is taken care of in the neonatal unit, then that is also an option. And in some cases, we take care of both the mother and the baby in the neonatal unit or in the maternity unit, depending on what the complication is. When the family has come home here in this unit that I'm working at, they have a contact with specialist nurses that are specialized in caring for babies and for children. So they meet them. They often do a home visit within the first week that they've come home, and just as a courtesy, so that they don't have to have an appointment to keep, because that might be a challenge coming home from the hospital like in the first week. So they bring the scale and go home to the patient. And often I make a call. So within 1 to 2 weeks, I call them and see how they are, if they have any special questions, if there's anything that I can help them with, how she is feeling, if she's had the vaginal tear, how is that feeling, how is the breastfeeding going, and of course the nurses also talk about breastfeeding and all of those things. And we also make an appointment for them to come and see me after about 6 to 8 weeks. And in some cases, if she's not feeling well, or if she's feeling sad or anything like that, I might make another appointment, an earlier appointment, so she comes and sees me before that as well, just because she's had a long contact with me, and the nurse who takes care of the baby, she might be like a new contact, a new person, so then she comes and sees me and talks about how she's feeling. In a lot of cases, it can be quite overwhelming becoming a mother. So then we talk about that, and I have the possibility of also referring her to a psychologist if I feel the need that she might be in need of that, and that might be something that might be helpful for her. After 6 weeks, I do a checkup. I check her blood pressure, her hemoglobin level. We do a vaginal exam if she's had a tear or if she would like to. We talk about the delivery, postpartum time, everything like that. There's also a unit in the hospital where she can turn to if there is a problem with her vaginal tear, or if she has questions, or if she's having a fever or stomach ache or anything like that. So they're also open like in the weekends. So that's also somewhere that she can turn to if there's any kind of problems in the postpartum period. And we also talk about birth control if she already knows that she wants to have an IUD fitted or an implant, then I put that in when she's here as well.
Interesting. That sounds amazing. Like you really support the mother throughout this transition in her life and as she's healing.
We try to, and of course there is a normal amount of her being a bit low emotionally and feeling a bit blue, but it is important for us to feel when does that turn into like a postpartum depression. So that is something that we always inform all our patients about, to like look out for those signs. But of course it's still hard. Often when they come back, if I see them a year afterwards or they come back for the next pregnancy, then they might say, now I can see that I probably had a postpartum depression, because they were so in it and that it's hard to see when you're in it. But of course, we try to visualize it with, like, they can fill out like forms, and we do a screening for depression and see if that is present for them when they're in that period of time. But of course, it is hard. It's a period when often you feel like it's normal to be quite tired, and it's normal to not feel happy all the time, and it's normal to not maybe feel like yourself. And a certain amount of that is normal, because you're not yourself. You have a small baby who might keep you up all night, and might be a challenge. So yeah, we try to help them as best we can.
Yeah. So afterwards, my midwife would call me just to make sure everything was fine. And if ever she had like an inkling that, hey, like maybe you're experiencing like postpartum depression, or, you know, maybe this is unusual, we would make an appointment happen. But usually, as long as she could check in over the phone, you know, that was the best thing, just so that, you know, we could all relax and get used to having a newborn at home. So it was good. It was like them being able to step back, you know, because also it's stressful getting babies to their first appointments just for them, right? So it was taking something off of my plate, but not neglecting me either. So they're, you know, there just in case something happened, or I'm feeling uncomfortable, or, you know, something needs help.
Midwifery is more than just assisting with birth. It's about supporting families through one of life's biggest transitions. But opinions on the right balance between medical care and holistic support vary worldwide. In some places, midwives are seen as holistic healers. In others, they're highly medicalized professionals. Let's hear me and Danielle reflect on how Swedish midwives strike that balance.
So I see my midwife, and she had been my midwife the whole time. And I liked how she said it, that her big role was to help, to be my advocate with the OBGYN and to kind of be the go-between. And it was her job that she would know what I want and understand my medical history enough to, you know, to step in if she needed to. But you know, also, I don't think, I never progressed to a stage where I needed to see an OBGYN either. It's almost like, oh, if it's, you know, maybe a C-section or an emergency, then you would see an OBGYN. I only had midwives at my birth.
So the OBGYN was there, but not not in the room at all, had no presence.
Mm-hmm. They're there if needed, but as long as the midwives had it, then then we were good. Then we were solid.
Well, in Sweden we have more midwives than we have obstetricians and gynecologists. And in the gynecological unit, there's a lot of midwives working. So even though we have gynecologists that work there, doctors who are specialized in gynecology, often when you go for like an assessment for an abortion, it might be a midwife who does the ultrasound, and it might be a midwife who has the consultation and helps you to get your abortion. And also, if you are having a spontaneous abortion at home and you have pain that you need to have help with managing, then that's also a midwife that you're going to meet in the hospital. So in cases where we need like more specialized care, then the gynecology doctor gets called. So yeah, it's also midwives who do the ultrasounds, the routine ultrasounds during the pregnancy. So if there needs to be like an additional ultrasound because of risks for abnormalities, or we might think that there might be too much amniotic fluid or something like that, or there might be twins or things like that, then a doctor might also be in the room or might also do the examination. But we have a very, very highly skilled team of midwives in the specialist mother care unit who do the ultrasounds. So often when it's complications, a midwife will do the ultrasound together with a gynecological specialized doctor. Yeah.
Interesting. And so who attends the birth? I assume midwives. Is the obstetrician even in the room?
No, not if there's nothing going on. If there are complications, there might be an obstetrician that is called. But if everything is perfectly normal, then in the room will be the woman giving birth, her birthing partner. It might be her partner who is involved in the pregnancy, but she might have an additional support person. It's perfectly fine for her to have 2 people to be there for her support. She's going to have a midwife, and she's going to have a nurse's aide that also works there. And in the delivery moment, when the baby comes out, there's going to be a second midwife. And that midwife is only there for giving a pair of extra hands if we need it. Usually she's just by the door and just stands off and just is there if we need her. But if there's no need, she just goes outside again. But that is a more recent practice, just so that there is a couple of additional hands available if we need them. But it's not like I've seen on TV, from the US, that there's a midwife who is there just doing all the work, and then when the baby's about to come, there's an obstetrician coming in, putting on gloves, push, and then it's oh, you've had a baby. No, we don't do that. It's us all the way.
Every mother's experience with her midwife is personal, but together these stories paint a picture of a midwife in Sweden, a picture defined by empowerment, compassion, and a deep commitment to the well-being of both mothers and babies. Today, we've journeyed with Mi Wihlström, a dedicated Swedish midwife, and Danielle, an American who experienced the Swedish birth system firsthand. From navigating language barriers to crafting birth plans and understanding the unique role of midwives, we've seen how Sweden's approach to childbirth is shaped by trust, support, and choice. Whether you're considering giving birth in Sweden, you're simply curious about how things are done elsewhere, or you're inspired by the stories of mothers and the professionals who support them, we hope this episode has given you a new perspective on birth, culture, and care. And we'd love to hear from you. If you have a birth story or an experience with midwifery, whether in Sweden or anywhere else in the world, please share it with us. Your story could inspire others and help us continue to explore the many faces of birth around the world. Thank you for joining us on Birth Without Borders. Don't forget to subscribe and leave us a review if you enjoyed this episode. Until next time, I'm your host, wishing you and your family safe and joyful beginnings.